tell you all how delighted I am to have this honor of emceeing today's event. It's been such a long time coming, and it's celebrating such an important occasion in several ways. First, let me introduce myself. I'm Ellen James. I'm the Executive Director of the Central Baltimore Partnership. Today's event is celebrating...
Because she can't hear you.
Oh, I'm sorry. Is that better? Yeah. Okay. Very important because you are the person who I want to speak to the most. And we both talked about how we're speaking from the heart today. But we're really celebrating three things. One, the rebirth of the city's largest affordable housing tower, J. Van Story Branch, with 350 units, 350 homes. And the opening of a long-awaited health suite that was inspired by Ms. Brenda Kauser, the longtime head of the JBSB Tenant Council. Let's get And finally, it's a celebration of a remarkable collaboration, one that you'll hear about through this proceeding, and one that we are already planning to replicate. The spirit and the generosity of the members who've come together to make this health suite possible, to get over all the many barriers, all the dead ends that we encountered over the 5 years that we've been planning this health suite, again prompted by Ms. Brenda's request. Many of you lived through and or remember reading about or hearing about the conditions that took place in this tower, almost 50 years old. Again, the city's highest remaining affordable housing tower. It was documented in the press by the Able Foundation, and we commissioned a study by Johns Hopkins University sociologist Catherine Eden and her students, who came and interviewed over 160 of the residents here. All of those reports spoke to the despair, the isolation, the very debilitating life experience of the residents here, and the deterioration of the building, which was largely the result not of any malfeasance, but of a steady and dramatic decline in resources that could keep these kinds of facilities livable. In response to that Hopkins study and to these reports, and we were hearing them from our residents, my office is just a block away, I and my staff came and met with Ms. Kauser and the Tenant Council, and the first thing they asked of us that there be a health center, that there be health services on site in the building. There had been occasions where there would be a podiatrist come through, maybe a dentist, social workers, nurses, but sporadically, occasionally, perhaps funded by one grant or another. And we committed to Ms. Brenda that we would provide a center that would be here, that would serve on site to connect residents to the services they need. In this building, a far majority of residents suffer from chronic health conditions, and we found that they did not have access to routine health care. There were a higher proportion of calls to 911 for ambulance services for conditions that really didn't need ambulance services, but because they didn't feel they had any other health service available to them. After our talks with the Tenant Council, we gathered together a wide variety of people to put our heads together. Paul Graziano, then the Housing Authority Director, was very supportive. Ken Holt, the Secretary of Housing at the state, also supported. And the whole host of nonprofits, Action in Maturity, Catholic Charities, the School of Nursing at the University of Maryland, the Charles Stewart Community Association, for which this building represents 1/3 of the residents, all came together to try to frame out what we could offer these residents. At the same time, the federal government and the city were working out an agreement under a program known as RAD, Rental Assistance Demonstration Program, whereby 22 public housing buildings would be transferred to private ownership. And again, it was to get at that loss of revenue that had resulted in these buildings becoming so deteriorated and unlivable. In that process, we got very, very lucky, and that is that this tower was awarded to Community Housing Partners, a Richmond-based nonprofit or developer of affordable housing that had a great reputation and has done projects all over the United States. And they are a key part of this story. That transfer, which happened in late 2018, was the first of several breakthroughs that made this project possible. And I'd like to thank from CHP a number of people, although I can't count how many of their staff were part of this process, but Samantha Brown, Angie Roberts-Dobbins, and if any of you are here, please, Andy Hall, Zeta Riggs, Margaret Poitras, Kim James, and Kim Strong. All of them worked with us to get over a number of the regulatory barriers that there were to creating a center like this in a housing complex like this. And it seems reasonable to expect, where so many residents suffer from health concerns, that this would be an easy thing, but it was not. We heard from every every level of government that it couldn't be done, that investors wouldn't agree to it, that you had to maximize the number of housing units and so on. But they stuck with us, particularly when, in 2018, Delegate Sandy Rosenberg sponsored a generous bond bill that we can talk about, in collaboration with Delegate Maggie McIntosh and then State Senator Joan Conway, the two of those latter representing this district, the 43rd State District. With the passage of that bond bill, we had the early money to create the health suite. We then, as this building was being renovated, the health suite was being created as well. And that renovation was complete in early January of this year. So once we knew that were getting close to the construction, we set about finding organizations who would operate the center. How could we finance this project? That was our next big hurdle. And we took a great leap forward when Ryan Moran, who's a member of the Central Baltimore Partnership Steering Committee, secured the agreement with President Brad Chambers of MedStar Union Memorial Hospital that Union would manage this center and would contribute financially to the center. With that breakthrough, we began to imagine how we could operate. Very quickly after, Maria Darby and Ruckus at Keswick made a similar commitment to both fund the center and to provide staffing and services. In addition, those two institutions brought along Sheppard Pratt and the University of Maryland School of Nursing. At the same time, we were standing up a task force that would help us really push out the envelope and the kinds of services that could be provided here. Not just direct health services or connections to direct services, but what kind of recreation, what kind of education, and so on could be provided. What kind of arts were in arts history. And Dr. Panagas Galiatzakos and Tom Scuccio agreed to head that task force. I think Dr. Kucha's and Dr. G. So together we have a remarkable program, a remarkable collaboration of health providers. They helped us raise funding for the operations of the center, which was provided so far by the Franz Marek Foundation and by Johns Hopkins University, with thanks to Elizabeth Cariella Rice and to Alicia Wilson and Ron Davis, President Johnson. Finally, we were ready to cross the last threshold, and that was the hiring of a very talented manager of the center, Stephanie Banks. Stephanie is with Kim's. she's very shy. Let me just stand for a second. She's going to Stephanie is the next chapter and the most exciting one of this center. She'll be leading the tours after the event. Finally, just looking forward, we've been in talks with Megan Lewis, who's a very exciting young artist whose studio is just a block away. She's agreed to provide a mural and extended artwork through the health center to make it as welcoming and vibrant a feel as it can be. Again, we're talking to other providers of programming that will complement the health services that you'll hear about in a bit. And finally, we've already gotten inquiries, as I think all the partners in the center have, from organizations who want to replicate what we are just launching here, because it is so exciting and it's so promising. I want to just add one more comment, and that is from Ken Gamula, who is a consultant to the Central Baltimore Partnership. He's the one who's put this whole collaboration together for us. He is observing the holiday of Sheppard today and couldn't be with us, but he wanted me to congratulate everyone, to urge you all to take a minute to celebrate, another minute to, as he put it, smell the roses, and finally, to take another step forward to expanding the kinds of health and happiness benefits that we're looking for here to the greater central Baltimore area and across the city. So I second those sentiments, and I thank you all, and I hope to be this with you. And now I'm going to introduce a number of the people who I mentioned here with great gratitude and great respect. And the first of those is Brenda Kauser, the head of the Tenant Council. Come on,
Good afternoon, everyone. Can y'all hear me?
Yes.
Okay, my name is Brenda Kauser. I'm the Tenant Council President for J-Van Shore. I've been living in the building for 23 years. I've been the Tenant Council President for 5 years. What I'm going to talk about is very small. The building is beautiful. When CPH took over, the building was a mess. But when I first moved in here, we had a beautiful building, but it went down. Now we got a beautiful building, and I'm asking all the residents, please keep it up. Kim James and Dave and them, they've been so beautiful to me. They have kept up with everything in the building. When you go to them with a serious problem, they'll look into it, they'll help you out, and I have to get them credit. And we also found that what we got is really nice in here is security. And we need the relevant program in here because we had it before, but I can't say why it left because I don't know. But I'm hoping they'll bring stuff in here because we need help. Number one, I'm a diabetic. I need the help. Two, I have pressure problems. So if you can bring somebody here to help us, I appreciate it. And this is a beautiful building, and I want y'all to give Zayna, Kim, and management, and them give them a credit. Slowly but slowly been coming to me for advice. And I can help with my will. When I can't, I send it to them. Because see, they can override me, I can't override them. They're the big balls, I'm the little balls. But it's nice being the Tenant Council President, and I told them, I'm not doing the speaking, but I'm speaking from my heart. I love the way our building looking. I've been here 23 years, so you know I enjoy this building. I'm not going nowhere. Well, if I got a problem, I don't let them go home. They have to talk to me. And I know they be ready to go home, but they listen to me. And they help me. So everybody here, Diane, all of y'all, all the people in here working has been very nice. And I hope, and I give y'all my clap. And I'm going to get off. let somebody else have something to say.
Thank you.
Thank you, Ellen. Thank you, Madam President. I'm here today because to tell you a little bit about J. Vance Stewart Branch and a little bit about myself, too. Yes. My first job after law school was I wanted to go work for the City Housing Department to work with Bob Emmer, because that's the place where things were happening in my hometown. And I was hired to be the number 2 person for the Section 8 existing housing program to get that off the ground. And my first boss was J. Vance Stewart Branch, who worked his way up through the housing department, through the housing authority, to become the executive director of the housing authority of Baltimore City. So this morning, I don't wear a tie anymore, especially in Annapolis I do when I'm before the house. But I said, Mr. Branch would wear a tie, and he would make sure that everybody who worked for him, because that's the respect that we should pay to our tenants, who are part of what he referred to as the family. And people deserve first-notch, top-rate housing, and that's why, I forget exactly when it was, Paul, maybe you know, 15, 20 years ago, I had the idea that we should rename this building the J. Vance Stewart Branch building. Now, it was important to be a member of the family who did not want to be called the dreamer by Mr. Branch, because these were the people who had, you know, in his view, far-flung ideas that weren't going to be reality. And perhaps, when folks first came to him with the idea for a wellness clinic here, he would have said, gee, we've had trouble doing the basics, doing the things that are essential. But, as Ellen referred to, there were a few dead ends. And once you demonstrated that that wasn't a dead end, that there was a need, and you had to find a way to solve it, all of the folks here today who were part of getting through those dead ends and opening the street up so that we could be here today, you would be part of the family. You would no longer be a dreamer, but you'd be part of the family. And now that I'm a member of the legislature and serving on the Health and Government Operations Committee, if I could be of any help in getting this wellness suite in other buildings, let's talk about it, because that's what Bob Embry taught me, and that's what J. Vance Stewart Branch taught me, and Paul as well, and that's why we're all here today, and let's do this for other folks as well. Thank you so much.
Thank you, Delegate. That's exciting. Can't wait to get started. Andoria is representing Mayor Brandon Scott. Thank you.
Good morning, everybody.
Good morning. Morning.
Morning.
Greetings from the mayor. I'm sorry that he couldn't be here today, but he's running a big city. So I want to read this certificate recognition. On behalf of the citizens of Baltimore, I'm pleased to present this certificate to the J. Vance Stewart Branch Apartments in recognition of the dedication of the new health and wellness suite. This project will enable tenants to receive on-site health services through a partnership with local health providers. On behalf of the citizens of Baltimore, I commend our legislative partners and the healthcare providers for helping make this project possible. Congratulations, Brandon M. Scott, Mayor of Baltimore.
Big smiles now.
I like this whole notion of speaking from the heart. So we'll start there. So my name is Penny Scully at Santos. I go by Dr. G on all the phone calls for obvious reasons. Baltimore born and raised on the east side. My parents immigrated here. And what is very obvious about Baltimore is that the best thing it has to offer is not its crowds or its football or baseball, it's its people. The grit and tenacity of its people it's learned, it's born, and it's inherited. And I love that. But in order for people to have the ability to reach their full potential, well, they need resources to do just that. And in my work, and with Dr. Cujo, our organization, Medicine for the Greater Good, at Johns Hopkins, we believe that knowing the science and knowing the patient gets you so far. You've got to know the community. And the best way to be knowledgeable of the community is to be out in the community, working with them. Not walking in their shoes, but walking next to their shoes. Understanding their struggles, their barriers. Medicine is not synonymous with health. We shouldn't think of it in that way. We should be present where they are located. They, meaning our human beings, our citizens, our colleagues, our friends. That's what we've done for the last 10 years, and that's what we'll continue to promise with this great medical housing partnership. We'll get our physicians and our nurses present, allocate healthcare resources, information and insight, and engage and empower our citizens, our Baltimore City brothers and sisters. That's how you make medicine a public trust, by working with institutions that have the public's trust. So that, Dr. Cujo.
Good morning, everyone. Can you all hear me?
Yes.
My name is Thomas Cujo. I'm a geriatrician, so I'm a doctor for older adults at Johns Hopkins. I provide care to older adults and individuals with disabilities in their home through our Johns Hopkins Hopkins Medicine program. And I'll just start by saying, about 3 years ago, a colleague of mine invited me to a conversation that brought together various healthcare organizations in our city to talk about the project that was being conceptualized here at MedStar Health. And after having visited many older adults in their homes in various housing communities throughout our city, I realized that this was a real opportunity to do something unique here in our city. And I would say that exists in the context of me having discussions with housing organizations around our country and visiting some of them nationally and even internationally as it relates to my research. And so when I realized that there was the hope to do something here in Baltimore, I said that this is something great. This is something great for the individuals who live in the building, but also great for our city. What we are doing here today is a true asset. It's an innovative approach to bring services to individuals that's most proximal to them. As I said, providing care to individuals' homes. I'm out in the community, and I know that that's the way we really achieve the promotion of health. We're bringing services and help in the most proximal way to people. So I'm happy to be here today. I'm happy that we've been able to come together as partners to push this work forward. I'm happy for the leadership of those who've come before us, who created the space and provided the resources here. And I look forward to continuing to work with each of you to realize the vision that Madam President has Representative shared with us earlier. So it's a great day. It's great to see you all here in person. I know the pandemic has been hard for us all on many levels, so it's great to come together here to celebrate the opening of MedStar Health Wellness Center. And as I said, I look forward to continuing to work with each of you. Thank you.
I'd like to bring up Angela Roberts-Dobbins, who will speak for the Remarkable Community Housing Partners.
Good morning, and thank you, Ellen. I'm so excited to be here today for a lot of reasons. I wanted to start off by saying thank you to everyone who's joining us here today in person and by live stream. This is a huge milestone for a lot of us, and we appreciate you so much for being here to celebrate it with us. I am Angie Roberts-Dobbins. I am the Vice President of Resident Services for Community Housing Partners. A little bit about CHP. We've actually been around since the 1970s, and we provide high-quality housing and service-enriched homes for low-income individuals and families across the Southeast and the Mid-Atlantic. Our mission is to create homes and communities that are healthy, sustainable, and affordable. J. Van Story Branch Apartments is our second redevelopment in the city of Baltimore and the largest real estate development project in CHP's history. We completed renovations on this building at the end of last year, and we are very proud of our work, not only to transform this community, but also to provide ongoing services and support to the residents who make J. Van Story Branch their homes. So, a little bit about health and housing for CHP. In 2015, CHP was introduced to the social determinants of health model. And basically what that is it shows that where you were born, you live, you work, and your play can have a significant influence on your health. We came to understand that our work to provide stable housing and supportive programming had a positive health outcome for our residents. CHP is committed to improving the health and quality of life outcomes for the people that we serve. In fact, this has been one of our 4 key goals in our strategic plan since 2017. The pandemic has highlighted health disparities within the communities we serve and has put a greater and sharper focus on the importance of home and the need to prioritize health and wellness. The opening of this health suite is the culmination of many years of hard work. As a matter of fact, as I was preparing for this event, I went as far back as I could in my notes, and it was March of 2016, and the note said, J. Van Story Branch is back on the table. Back on the table, meaning we have been talking about this project for a lot of years. That was 2016. In 2018 is when we first met Ms. Brenda, the tenant council, and the residents here at J. Van Story. It was actually July of 2018 when Dr. Cujo and Dr. G joined a meeting over at Johns Hopkins. And at that time, the health suite was a little more than an idea. But what came out of that meeting in July was a lot of dedication from a lot of partners. So that was pretty monumental for CHP and for this site. So we wouldn't be here today without many partners. First being the tenant council and the residents in this building, the Central Baltimore Partnership, MedStar Health, Keswick, Sheppard Pratt, Johns Hopkins Medicine, the University of Maryland School of Nursing, the American Heart Association, our legislators, public officials. They're the ones who secured funding and supported us along the way. It's taken us a lot of years to get to this point, and we're so very thrilled that all of the hard work of everyone involved has led us here. J. Van Story Branch Apartments has a bright future, and the opening of this health space for our residents has made that future even brighter. Thank you so much.
My heart just keeps soaring. And now I'd like to bring out the folks who are going to be operating the center and hopefully helping us replicate it as well. Dr. Lucas Carlson, the Regional Medical Director for Care Transformation, very appropriate title, at MedStar Health, and Maria Darby, the Chief Operating Officer in Keswick. They'll introduce their leadership, and then Stephanie will lead us on the courses.
We're so excited to be here. As you've heard, this initiative is all about the power of partnerships, and the goal of the J. Van Story Branch Partnership is to address the social determinants of health, as well as the physical health and well-being of the residents. Inside this beautifully renovated building is a 1,000 square foot inviting space called the Health and Wellness Center that includes an office, counseling rooms, an exam room, conference room, and waiting area. The center is the collaborative work of the whole advisory committee led by Dr. Thomas Pujo and Dr. G. We are pleased to share that MedStar, Union Memorial, and Keswick together will provide oversight and support of the center. This joint management structure evolved out of our partnership work and focuses on the strengths of the respective organizations, with MedStar providing health oversight and Keswick offering support of wellness initiatives. More important, however, is that we have recruited an enthusiastic director with experience in community health program and service navigation with a focus on client engagement. Her name is Stephanie Banks, and I hope that you take a moment to talk with her today. Stephanie, we're excited. We're so excited to have her. She is really the future of this kind of work, and it was so really powerful to be part of that interview process, to see all the people that wanted to be engaged here, and Stephanie sort of soared above the rest, so we're thrilled to have her. In addition to the on-site staff, MedStar, Keswick Community Health, and a bevy of other service providers will support Stephanie in developing programs and services of interest to the residents. The overarching goal is to meet the residents wherever they are in their health and wellness journeys and provide the supports that they need and want to achieve the goals that they have defined for themselves. This unique management structure of the center and program operations in tandem with the Central Baltimore Partnership and in collaboration with community housing partners and the J. Van Story Branch Resident Council assures that residents will receive holistic, wraparound supports to enable them to live their best lives. The goal is that through this multifaceted initiative, we will promote and improve health outcomes for the residents and those living in the surrounding community. Thank you. Now I'm going to turn it over to Dr. Carlson.
Thank you all for being here. So, in our community, the problems that our patients face are often a matter of accessibility rather than availability. Just here in this neighborhood, we have Grand Assistance Center, Institute for Behavioral Resources, Central Baltimore Partnership, not to mention 3 renowned healthcare systems within a 3-mile radius. Recognizing this, we decided to leverage this space to coordinate wellness activities, to break down barriers, and to increase access to services. We made it our mission to promote the health and wellness of J. Van Story Branch residents through supporting access to care and chronic disease management, including physical health conditions as well as mental health and substance use disorders. We organize this work into 4 primary areas of focus. First, to conduct education, prevention, and screening programs. For this, we'll work with our partner organizations, many of whom are here today, to coordinate on-site and virtual programs. These will include smoking cessation classes, diabetes education programs, blood pressure screenings, as well as fitness and wellness programs. The next focused area is promoting access to primary and longitudinal care. For this, our site coordinator, Stephanie, will fall back on her training and experience as a community health worker to work with residents to coordinate longitudinal care services. This means to help them find a primary care provider, to schedule appointments, to work with their health insurance companies. We'll also have 2 counseling rooms that are equipped with webcams that will double as telehealth appointment spaces, helping to bridge the digital divide that has become so stark during the COVID-19 pandemic. The third focus area is to support residents during transitions from acute care, meaning follow-up from emergency department visits and inpatient hospitalizations. This will include reviewing discharge instructions with them, assisting residents with obtaining their prescribed medication, scheduling and attending their follow-up appointments. And the fourth category is facilitating resident linkages to behavioral health support services, specifically mental health and substance use disorder. This focus was actually specifically requested by the residents after a string of fatal overdoses that occurred earlier this fall. Mental health and substance use disorder are implicitly included in the previous 3 categories, but residents wanted this to be specifically highlighted in the program. For this, we're working with partners, specifically Sheppard Pratt and Reach Health Services, which is less than 2 blocks away from the building, to ensure that residents are able to access treatment for substance use disorder, including counseling and medication treatment, as well as services for mental health and mental health crises. These programs and services will continue to evolve and grow as the resources and partnerships for this program evolve and grow as well. But ultimately, our hope is that through this program and partnerships like this, that we can empower the individuals in this community to overcome the barriers that they face to care and access the care that they need and deserve. Thank you all very much for your support. I'd like to introduce Neil McDonald, our Chief Operating Officer at MedStar Union Memorial Hospital, as well as MedStar Good Samaritan Hospital, to come up and speak as well.
All right. And he'll be joined by Carmel Rope, the President and CEO of Keswick.
Good morning. Can you hear me okay? So I'm glad I don't have to go last and have some wonderful pithy thing to say to close us all out. I do have some prepared remarks, but because time is growing short and we've been sitting here for a while, I'm just going to make a few comments. I do believe that if you can dream it, you can do it. And the power of vision to make something like this wonderful initiative come to life is really, I think, what today's celebration and remarks are all about. Look around the room, and there are some people here who have been on a very long journey toward this day, but also toward imagining the ability for all of our citizens to have access to health care and to the services and supports to live a wonderful, high-quality life. I know that Liz Briscoe, who I've known in her many roles, and who now is supporting the Maryland Philanthropy Network Aging Funders. So we're both aging, but we're also funders. Liz and I have worked for 10 years together on just this kind of a program coming around. And I also see Mr. Moran sitting here, who has also been a friend, a colleague, and an incredible support for Keswick and our efforts to be able to be a true community partner and to work with our healthcare systems in a way that actually brings support and well-being to folks who live right here in this building. And my dream is, because I am a great believer in it's only lack of imagination that limits what it is that we do. I am very hopeful that this will actually be a replicable model. And we will see this all over the city of Baltimore and the state of Maryland. So that not just our wonderful residents here in this home, but across the city and the state will be able to enjoy the privilege of these kinds of services, which they deserve and which we want them to have. So thank you very much.
Over the past 14 months, the COVID pandemic has shone a bright spotlight on the gaps and inequities in the healthcare system. Too often, patients in our community are faced with insurmountable barriers to care. Despite Baltimore being home to some of the most renowned health systems in the region, many communities in our city, including older adults, people of color, and individuals with disabilities, experience disproportionately poor health outcomes. These outcomes stem from the various social, economic, and environmental determinants of health, as well as inadequate access to care. At MedStar Health, we're dedicated to supporting our community and ensuring that all people are able to receive the right care in the right place at the right time. Through the Health and Wellness Suite, residents will have access to invaluable services to support their overall wellness. As you've heard today, these services will include health education programs, fitness and wellness activities, and assistance with navigating the often overwhelmingly complex healthcare system. MedStar Health is proud to be part of the team that has launched this effort to promote the health and wellness of the J. Van Story Branch community, and we're thrilled to have the opportunity to provide ongoing program leadership for this initiative in partnership with Keswick and all of the organizations you see listed behind me here on this banner. Before the recent renovation, many tenants reported feeling fear, a sense of despair, and isolation in the building. We believe that this Health and Wellness Week will be a source of pride for the building's residents by empowering them to achieve optimal health outcomes, and that it will serve as an example both locally and nationally of the potential impact of integrating health and housing. I'd like to thank Community Housing Partners for their endless support for this innovative program and for recognizing the fundamental connection between health and housing. I'd also like to recognize Central Baltimore Partnership for championing this project over the past 5 years and assembling this incredible team. And last but not least, I'd like to thank the City of Baltimore and the Baltimore City Health Department for their ongoing leadership and dedication to our community. Thank you all so much.
Just like I'm exactly where I need to be at the